My name is Peter Poulet. I'm the 23rd New South Wales Government Architect, a lineage that goes back almost 200 years. We'll be celebrating our 200th birthday in 2016. And part of my charter at this point in time is to make sure that we've got another 200 years in the office. And most recently, I found the need to reinvent who we are and what we do. And that's how I end up in a room like this on an afternoon like this. My office has partnered with UTS and specifically Case Dorst, although I see Roger Watson here, to introduce design thinking, not just to the way we go about being architects and problem solvers, but introducing that concept across government or infiltrating into New South Wales government some intelligent and innovative thinking. And it's interesting that it's come from architecture. I'd like to point out that it works specifically for architects as a way of managing design. It's a risky process absent from the corporate or government world traditionally. Smart architects, and I didn't slur my words in that case, already know how they no longer are able to define and control every detail of a large project. So to me, design has become a process of mediation and orchestration amongst numerous stakeholders and specialists. This becomes a cooperative process driven by a core concept or conviction. Architects work with inspiration from many different aesthetic and scientific fields. This gives them a capacity to synthesize ideas and influence previously unseen connections and synergies. Architects are trained to work with scale and abstraction. When applied to management and policy frameworks, the potential is to radically innovate. At this point, I'd like to introduce our first speaker, Jane Treadwell, advisor to the World Bank and an independent consultant, but you probably know her as being CEO of DesignGov, the Australian Centre for Excellence in Public Sector Design. There's more detail in the little brochures you have. I'm sure you'll be reading them this evening. Jane, please.
Thank you. And thanks for turning up. We weren't sure whether we were going to be popular today, but we are.
More chairs.
So I might start by asking you a question that I used to ask when I was working in DesignGov, and this at times went to all of the senior bureaucrats in the public sector, or it could have been in Melbourne or Wollongong or someplace. But who in this audience considers themselves a designer? Well, that's quite a few more than I've ever received in the past, although many of the secretaries of Canberra considered themselves designers because they were about designing different ways in which policies and services were delivered. Who considers themselves a radical innovator, picking up Philip's point? A few. And who thinks it's all just a load of labels and you're actually more interested in working out what works? Yeah. So I suppose that might help you understand where I'm coming from, especially after hearing a lot of the presentations this morning talking about behavioural economics, and then actually recognising that in fact, there's a lot of techniques that we all use if we're concentrating on delivering better outcomes or trying to find out what things work. And I've just put around that first pyramid, if you like, if it's around boundary definitions or actions that we're interested in, there are so many techniques around ethnography, building personas, doing citizen journey maps, framing, or as Roger does, reframing of problems, visualisation, you name it, there are many, many techniques. And in fact, they all have a place. And what, in fact, we're, as designers or people wanting to make a difference in the way in which our worlds work, is to look at which ones do we use under what conditions. The notion of design thinking being intelligence made simple, or as Bill Clinton, who's become a sort of a recent advocate, is that you design in an evolutionary way towards perfection. You can't actually get it right first time. And I think we heard a lot today around testing and prototyping. The other interesting thing too around design thinking is around the ecosystem of interests. And one of the critical elements that changed my thinking around design was when I read it of a person who said, unless you involve the impacted, the influencers and the controllers in the problem framing or describing and the solutions, you're not likely to get it right. And that sort of notion of building up the ecosystem and bringing the ecosystem into the space of looking at the problem and its range of solutions is very important. But when we're talking about those definitions or taking action, perhaps we're actually just really keen to create a better outcome. And it's around experiences and interactions and being able to draw on the evidence. So there is another session going on about data, but design doesn't ignore data. It might actually draw on the sort of the scientific facts and then actually find out what real people are thinking and behaving and doing and observing those. Equally, giving those real people, along with staff and the other influencers, the ability to imagine out loud what the space or the issue might look like were they to have free range of anything. So I guess I don't care what you call it. If it actually means that the decision makers and the people involved in creating a better space want to call it something, let them, but let's actually understand that the design process is actually a disciplined set of actions that take you from a current state to a preferred better state. And if you involve them, the ones who are impacted or influential in that process, you're probably going to get to a better space. The other elements that we in DesignGov also discovered in the course of our 18-month pilot, and Alex Roberts is in the audience as well as me having had this wonderful experience, is that the process of design that starts from sort of trying to understand the problem right through to design and implementation and scaling up can be rather messy, and you can go backwards before you go forwards quite a few times, and that iteration actually builds and blends a whole lot more of insights around what might work. But we were asked in this panel to actually give us sort of a sense of how we thought behavioural economics or insights differs from design, and I guess I'm not going to actually tell you what the differences are too much, because it seems like the umbrella term behavioural economics has expanded enormously this morning. But it does say, picking up Maria Katsonis' point in a question about, well, behavioural economics is picked on the sort of low order, simple problems where there's an understanding of the relationship between cause and effect on the transactional areas. And in many of the areas where Alex and I worked around design thinking, it was in the complex space where there isn't an understanding between cause and effect, and only where prodding and sensing and responding and then reflecting can you actually get more of a sense of what might work. Never assuming that there is a solution, as Ken Friedman from Swinburne University told us right from the start. Complex problems will be made better or worse, but they'll never be solved. So don't set yourself up. So I think in terms of that diagram on the right-hand side, that area of complexity where you're still trying to work out what the issues are and how you might actually respond to them, that seems to be an area where the design thinking mob have done a lot more work. But it's not at the exclusion of the understanding. It's very important around behaviours, insights gained from what people are experiencing, and how they might respond under a different set of circumstances, which picks up my third point. Context and circumstances make a bloody lot of difference. Timing in terms of introducing new techniques is the most critical thing. As someone said, and I'm one of the revolutionaries that helped create Centrelink. It's not all my fault, but one of the things that allowed for the merger of 3 departments, the focus on citizens or customers within the Commonwealth Government in the late 1990s, was that those circumstances and timing were when some secretaries were retiring, a number of ministers were keen for it to happen, and it was just perfect timing. And whether you have an outside-in perspective, which brings comfortably on board the views of customers or stakeholders, or an inside-out perspective that deals with the more mundane, but at least it's stepping forward to a change, that's really a matter of timing and leadership and comfort. What we found in DesignGov was that there are some already very well-established mechanisms for understanding what design and design thinking tools and techniques do. The real difference is actually drawing the threads together so that you're constantly building to that preferred better state. Asking why 5 times. If you haven't done it since you were 3, try it again. Why are we doing it this way? Surfacing the assumptions about why people do things that way, including why decision makers are doing, and focusing on that. Building personas. I heard the people from Teck talking about the importance of doing that next, and Murray Johnson did it really well within citizenship and immigration, because all of a sudden stats become real people and provide insights to actually helping define a different thing. Of course, the EAST process in prototyping, and seeing prototyping as a risk mitigation effort is just fantastic. The same as employing or customer feedback or inviting people to actually tell you what they think becomes a perfect way forward when things are looking a little bit scary in terms of options which you don't quite know which way they'll move. And finally, that sort of focusing then down into specific solutions that can be scaled or abandoned. And we've heard today too about the importance of understanding that failure might occur, but what that does is then allow you to divert resources to the things that will work. One of the key projects that we did within DesignGov was looking at a problem framed in the way of a question that opens up opportunities for ways of doing things better. And the question was, how might business and government interactions be dramatically improved? Because 70% of businesses think that government doesn't know about business. Interestingly, we discovered that 70% of staff dealing with businesses have actually worked in the public sector, have actually worked in business, and in fact have owned businesses. So it's really interesting what a little bit of scratching around will find. We applied ethnography, we worked with anthropologists, we created networks, we worked with peak business organisations, we used technology to actually uncover what people thought, as well as both in terms of issues and ideas. We ran cross-sector workshops, which were fantastic in terms of the preparedness of people to get involved, which reinforces a lot of what we heard earlier today. The framework for answering this question, which apparently Northern Ireland is actually keen to find some answers on as well, was pretty interesting. It wasn't just a normal framework from a policy perspective, but done in the words of the people who are sort of struggling to navigate government. So why not let business people guide business people to the answers within government through crowd solution? Why not have a single way of running a consultation mechanism or framework so that everyone within business can actually find out what are the policies being contemplated, or the ideas around those policies being done, so that you can time them effectively. And collaboration was an absolutely key element, but essentially bringing together people using words that make sense to the policy wonks, but also the real people who are struggling to navigate government. And also building the capability across government agencies to actually giving them confidence to pursue change and challenge in a way that drew on the voice of businesses to change the sort of status quo within government. Interestingly, and I'll just use this as an example, one of the ideas was that red tape was really problematic, too much red tape. And that's certainly what many governments have been pursuing for a number of years. What we heard was that it might not be the volume as much as the constant change, that people just didn't know what had changed this week versus last week. And that, in fact, the red tape was not just a problem for businesses, it was a problem for public servants. And the fact that they got completely tied up in red tape to actually get things happening was something that many parts of government could probably listen a bit more to their staff about what's toxic and what should go. So, given that many public servants actually join the public sector, or people enjoy working with the public sector to make a difference, this is what we learnt. That wearing the citizen's shoes is just the beginning. Being open and listening, but also engaging, is just the start of what will make a difference. Reframing the problems opens up the possibilities if you ask it in the form that doesn't direct you to a technology or a structure, but actually opens up the opportunities to see the issues in different ways. Understanding lived experiences is critical because they provide you with the basis for insights that will actually work out what costs an arm and a leg that's not necessary or just gets in the way and can improve outcomes. And the loveliest thing about the design community is that they say start by doing, don't write me a brief on it, or just, you know, if it's going to take you 3 years to get up a randomised controlled trial, do a bit of that, but do something else that will actually generate more insights and actually engage a community that's sort of dying for some change. The network and the system really matters. You can't do this by yourself, and particularly in really complex spaces, single departments, even single jurisdictions aren't going to shift ground too fast. Effective risk mitigation involves the ecosystem in co-design and prototyping, and it's all around the way in which, I suppose, we pitch it, but also how we actually reinforce that value, and that there are a bloody huge number of techniques available and tool sets. There are now websites around service design, tools.org. There are a number of academic groups that are building up libraries that can be provided to people if you just want to have a shot. And I think, just closing, the whole issue of language and leadership is something that we have yet to really resolve or sort, but if we start by doing today, we'll make it a whole lot better tomorrow.
Thank you, Jane. I didn't say at the onset that I'll ask people to hold their questions till after all the speakers have presented, but I'm expecting insightful and pertinent questions to flow after Hector. Oh, all right, okay. We've changed it. Okay. Siong, industrial designer with the Khoo Teck Puat Hospital in Singapore. Welcome, and if you could share your insights, please.
Okay. Can everyone hear me? All right. Good afternoon, everyone. My name is Siong. I come from Singapore, and thanks for having me here. Okay. Yes. Okay. So what I will be talking about today is how we use design or design thinking to change behavior in healthcare. I think we have all heard a bit of what are the behaviors that healthcare is trying to change in the earlier talks. Okay, so a bit of an introduction before I go into my main presentation. I come from Alexandra Health System, one of the 6 healthcare clusters in Singapore. We we take care of 700,000 residents staying in the north of Singapore. And currently we run a acute facility, Puat Hospital, and also building a few others ranging from primary care to step-down care, and also another acute hospital. Okay. I'm part of a very small team in the hospital, the healthcare innovation team. I think some of them are here today. Maybe you can just stand up so that I'm pointing them out so that they can help me to answer some questions later on. Yeah. So the team comprises of designers, researchers, as well as clinicians. And we are mainly from a non-healthcare background, which actually has proved to be quite a unique value we bring to the organization. Okay. Can anyone name a few behaviors that healthcare is trying to change? Just anyone?
Obesity.
Okay. Sorry? Smoking. Okay. All right. So I think it's very easy for everyone to know what are the behaviors that we in healthcare want to change. Sorry. It's not coming up. Okay.
Point to the man.
Oh. Okay. It's supposed to come out with something. So, yeah, it's missing some pictures. Okay. So the behaviors that we are trying to change are things like inactive lifestyle, unhealthy eating habits, smoking, and also things like medication non-adherence. So these are the behaviors that we want to change, or we want our patients to improve. And when we look at this kind of problem from the healthcare perspective, like for example, medication non-adherence, we see a bunch of statistics. And it could be about increased readmission rates, increased death rates, or of disease burden, or even increased cost to the healthcare system. And we very seldom look at it from a patient perspective. So in one of the workshops that we conducted, we decided to tackle this problem. And we gave the participants some materials to understand from the patient's perspective. And it could be a recording of what the patients are saying, or a diary of what the patients wrote about their life, and things like that, to understand from their perspective. And we found that what was the most impactful material that we gave to them was actually this pair of glasses here. It's actually a glass that we have blurred out the lens in order to simulate the elderly's vision. And what the participants told us was when they put on this pair of glasses, they felt fear. Why were they scared of taking medications with this kind of vision? It was because they were worried that it was not their medication, or it was they were taking medication that has been expired or in wrong dosage. So it was a very powerful emotions that triggered them to come up with ideas like redesigning the labels to make it more legible, or even having eye checks when the patients receive prescriptions. So my point is this, is that it's very easy to make judgment or assumptions when we look at why people are behaving this way. Why are they not taking medication when, it's good for them. And, but we need to really think from their perspective and why they are behaving in this way in order to come out with ideas or interventions to change their behavior. Okay. Our innovation approach is based on the design thinking process. And so there are a lot of different variations of the design thinking process. I'm sure you have seen a few. We base it on 3 parts, which is to understand, to explore, and prototype. So these are the 3 main spirit or the essence of the design thinking process that we try to inculcate in our staff. Okay. I think it's the wrong slides, but yeah. Okay. So so what's the difference between design thinking and behavior science, or the similarities between them? I liken them to be like a bit like twins, but with different outlook. One of them has more of the artistic look, and the other one is more of the scientist. And so they have the same fundamentals, but just different ways of expression. And for design thinking, how design thinking tries to go about solving problems by first understanding, and then to, if I remember correctly, this was to explore, and then lastly to affect change, while behavior science tries to look at or seeks to examine and explain a phenomenon, and then creating a hypothesis and, in order to test. Okay, but ultimately, I think both methodologies have the same goals, which is to look at behavior change by introducing design or interventions. Okay, my first, okay, I'm not sure whether I should change the slides, but okay, I will just stick with this.
It's a bit late now.
Yeah, exactly. I should have checked it, but okay, anyway, okay. I'll be running through some of the case studies that we try to influence change in behavior. The first case study is a project on how we can stop patients from coming back to us so frequently or unnecessarily. The problem we have was we have too many patients. I mean, it doesn't really sound like a problem until you see this picture here. It's actually a picture of our emergency department, and we have patients waiting really long hours to get a bed in our wards. So, and then sometimes we even have to resort to using cot beds like this to increase the capacity. And a very direct way to solve this problem is, of course, to increase our capacity by building more wards, building more hospitals. This will take time, and so we decided to go with another approach. We looked at our data, and we found that there were this group of patients we affectionately call the frequent flyers. Yeah, so they are coming back to us with more than 3 times over a 6 months period, and they take up almost 10,000 of bed days. So a team was set up to go into these patients' homes in order to understand why are they always coming back to us. Okay, some of the stories that we found include this gentleman here. Okay, this gentleman here, when we went into his home, we realized that he was living with his other elderly sick spouse, and they were taking care of each other. So they do not have an able-bodied caregiver to help them with their daily chores. And in their bathroom, you see the picture of the bathroom. There's this ring. It's actually a belt that's mounted onto a shelf in the bathroom to help lift themselves or lower themselves onto the toilet seat. We identified that this is actually a potential hazard, and we arranged for contractors to go in to install grab bars. But unfortunately, before we could even get down to it, the belt snapped and he fell, and he suffered a hip fracture because of that. So he has to be sent to the hospital. Okay. And another patient that we visited was this gentleman here, Mr. Jimmy Tan. He has a condition called COPD, which is a lung condition, and he was prescribed with an inhaler. And when we went in, the nurses asked him whether he knows how to use the inhaler. So he very confidently told us that he knows how to use it. And when they asked him to demonstrate to us, he was blowing into the inhaler instead of inhaling. And when we corrected him, he told us at first he was using it correctly, but when he showed his neighbors, the neighbors told him he's doing it wrongly and he should be blowing into it. Maybe he was inspired by how the breathalyzer works. I'm not sure. Yeah. Okay. So from this, we can see that a lot of the factors, a lot of the factors that the patients face, or a lot of the elements that the patients face at home, it could actually be avoided. And things like social economic pressures, how they apply self-medications, how unsafe their homes is with all the hazards that might make them fall or things like that. And also some of the caregivers, mainly domestic helpers, they're untrained in providing the level of care that the patients need, or even polypharmacy of a lot of elderly patients having a huge amount of medications, and which one is expired and which ones are the ones that they should be taking. They probably have no ideas. So we developed a program we call the Aging in Place program, where we have community nurses go into the patient's home to understand their situation and provide care beyond just medical needs. The nurses become a single point of contact to coordinate care between different agencies or services, and they provide these patients with services like basic needs, meals, social, financial support, and they often, and our early result has been encouraging. Out of these 400 patients that we piloted this new model on, most of them have reduced readmissions. So from 3.5 readmissions, we managed to reduce it to 1.2. And for length of stay, when they are admitted, we managed to reduce it slightly by from 6.17 to 5.94, because when they really have to come to the hospital, they still need a certain level of care. But what is most impressive was that there's actually 47% of them that do not have to come back to the hospital at all, with the nurses going in to take care of them. And what this means to the hospital is we are freeing up to 32 beds in the 6-month period. And this also means that we are freeing up 16 nurses' time to look after patients who need the care more. Benefits to the patients, mainly in financial terms, because there's a reduced readmission rate or a slightly shorter length of stay in the hospital, they save up to $5,000. Okay, so I think from here we can see that if we did not go into the patient's homes, we would not have known what kind of care that they need in their homes and how we can prevent them from coming to the hospital. So we'll probably be continuing to build more hospitals, build more wards to just curb the demand. Okay. In the next project, we were looking at how we can enable patients to better monitor their conditions. And this is for the condition of cardiac failure. So patients who have cardiac failure needs to monitor two things. One is their weight change, and also their fluid intake. So here you can see some of the pictures of what we found when we went into the patient's home to see whether they are coping with their conditions fine. And there are varying degrees of competency. Some of them have nice sheets and proper template to write down all the measurements and statistics, while some of them, they just use a notebook, and when the nurses say, I want to check, they will probably just write down all the same weight. And some of them, they also buy their own measuring bottles with indications of the capacity to know how much they are drinking. But while some of them, they just use like their daily cup and estimate roughly how much water they are drinking. So another thing that we found was that when we asked them what is the most important parameter to monitor for heart failure, for a nurse, weight is the most important, followed by swelling, blood pressure, heart rate, and breathlessness. But for patients, when we asked them, they told us that the most important was blood sugar level, which is not even part of the consideration for heart failure at all. And they said that weight change was the least important. So from here, we can see that there's a big difference in how patients are understanding why do they need to monitor certain statistics, and what are the things that they have to do to prevent the condition from worsening. Okay, so with the help of actually a polytechnic in Singapore, we came out with a toolkit, and it consists of a self-monitoring calendar, for patients to record their weight every day. And under this recording, they can reference it to this chart where we use the traffic light system to show them that if you're of a certain weight, you're in the green zone. If your weight is here, you're probably in the yellow zone and you need to call the community nurse. And if your weight falls in the red zone, you have to call the ambulance immediately. Another thing that we gave them was a fluid limit bottle. And there are personalized markings on each of the bottle to let them know that how much water or how much fluid they can take every day. And also a reminder poster for them to paste in their home to tell them to take their weight, and also what are the things that they need to, the action plans that they need to follow when their weight or to measure, to monitor the swelling of their feet. Okay. So currently we are testing it with some of our patients, and the early result has been quite encouraging because a lot of our nurses say that it's easier to get the patients to understand and comply with the instructions that they tell them. And we found that actually sometimes a product is very useful to get people to be motivated and do repetitive habits in order to ultimately change their behavior for the long term. Okay. As I said earlier, there are a lot of habits that we in healthcare want patients to change. And the examples that I'll be showing later on are some examples of how we use nudge principles to do this. So for example, there are visual reminders everywhere in the hospital to tell people to take the healthier options. So in this case, we are trying to get people to use the stairs instead of the escalator or the elevators. We also try to get people to exercise more by using fun as a motivation, okay, and also to get them to exercise without realizing that they're exercising. So this is a bicycle that we mounted beside the hospital, and it faces a pond. And when you pedal the bicycle, it pumps up water and it shoots up through the holes in front. And sometimes from the side, it looks like you're peeing. Yeah, because of the angle of the hose. Yeah, so I mean, on a daily basis, we see a lot of kids as well as adults who, when they walk past it, they're curious enough to get on the bike and then just pedal and do a bit of exercise. And we also have priming when our patrons or people who are walking on their journey to the canteen. So this is what we call a BMI chart. And you can plot your weight according to your height in order to know what is your health risk. So this helps people to know, or implicitly remind them that they need to make the healthier options. We also have priming at the canteen. There are blood pressure machines or even body mass index machines to remind people that don't only choose the food according to their taste, but also choose according to their things like calories or the salt content and things like that. Healthier options are cheaper in the hospital. Here you can see that brown rice is cheaper than white rice, and this is usually not the case in other canteens where brown rice are usually a lot more expensive. Besides being cheaper, healthier drinks are also made more accessible. So healthier drinks are placed at the eye level, while gassy and sugared drinks are placed at the lower level. Okay. We also try to couple actions with consequences. So during festivals, we tend to snack or indulge in unhealthy junk food. And we gave out these stickers where either our staff or our patients can stick on their, the container of the junk food and remind them that every bite that you take is actually has certain consequences. So in this case, every piece of this, we call it kueh balu, which is a Malay snack, is equivalent to 1 lap of brisk walking around the track. Okay, we try to take behavior insights in order to stimulate ideas in the design process. So we made a toolkit, and it has two components. One of it, you see here, the blue deck is actually behavioral concepts that is related to healthcare in order to explain why people are behaving in a certain way. And the pink deck is actually to get people to be inspired and generate ideas or strategies in order to counteract the behaviors, the unhealthy habits that they have. So from the examples that I've talked about, we can see that the value in both science and design lies in what they can teach us about people, okay, in order to know how we can better change their lives. Of course, changing behavior is a really tricky business. So be it behavioral design or behavioral science or design thinking, we need to first understand from the perspective of the people that we are trying to change by looking through their eyes. Thank you.
Thank you very much, Siong. These feel very practical and direct solutions. It's innovation. I recognise this. I'm a little concerned about the first project you showed, which was doing all those fantastic architects in Singapore out of work, building more wards. But we'll talk about that later. Look, being the creative innovators that we are, we've moved from the program I've got. Carolyn, I believe you're up next, according to the...
According to this, yes.
According to this.
Technology dictates.
It does. The CEO for the Australian Centre for Social Innovation, Carolyn Curtis, please.
Thank you. Thanks, everyone. It's great to be here today. I was asked to specifically talk about co-design and human-centred design. And I just want to start by saying that co-design is a word that we're hearing everywhere at the moment. And so I'm going to talk to you today about what co-design is for the Australian Centre for Social Innovation. And I'm also not going to keep repeating our whole name. I'm just going to refer to us as TAXI from now on. So TAXI have been really focused on developing and refining our processes around co-design now for 5 years. And for some other people, maybe even in this room, you'll have a different interpretation around what co-design is. TAXI's been around, like I said, for nearly 5 years, and we exist to tackle some of the most complex social problems in Australia. So some of our focus areas at the moment are around trying to improve outcomes for families interfacing with the child protection system, around people that are carers, whether that's caring for an aged relative or someone with a disability, and also our Indigenous Australians. For us, co-design is a interdisciplinary methodology, and it really draws quite strongly at TAXI on three disciplines. First of all is design, and we employ quite a number of designers from an industrial, graphic, product background. But secondly, we think that the social science element is fundamental, and that understanding behaviour, how behaviour happens or why it doesn't happen, and understanding the context of behaviour behind people is fundamental to the work we do. And then thirdly, business and business innovation. What is your business model for what you're trying to create? Who are your customers? What are the assumptions that sit behind all of those customers? And how do you use design processes to go out and test those assumptions? So everyone that works at TAXI doesn't sit in one of those particular bubbles. Everyone's upskilled and works across all three. And for us, that's a fundamental part of co-design. So before Nicholas was talking about the term hunches, and yes, we do use the term hunches a bit at TAXI, otherwise known as assumptions. We don't just sit on them though, we do something about them. And I guess for us at TAXI, if you're not spending at least 50% of your time out of the office, then you're not doing co-design. And so in your group or in your office or behind your desk for us is really around framing your assumptions and what do you believe to be true about the people you're working with or for or between. And then when you go out into the community, how do you actually test those assumptions? And this is an iterative process. For us, co-design is not a one-off consultation. It's not about asking people what they want and then just making it for them. There's many examples of people doing that and it failing miserably. So this process is not just a process that happens with your end user, e.g. a family, where you would go and have conversations with people who are part of the system, frontline workers, policymakers, funders, family members, people that make up the whole ecosystem for that particular family client that you're working with. So here, I guess for us, this is just to show that it's really an iterative process. It's not a one-off thing. And we see this as a way to really reduce risk by kind of front-loading your process. And so to start with, it's really about framing your assumptions. And some of those assumptions as well are about the problem. And so often in my former life in child protection, I was certain that I'd be doing the right thing and I would have the best of intentions when I would go out to implement that new program or idea or policy. And it turns out that often that we were really barking up the wrong tree and where we were coming from and where the family were coming from were entirely different. So the starting point for us is about understanding the problem. And just human nature says that we always want to jump to the solution. So what is the program? What's the idea? What are you going to implement? And I think one of the hardest parts is that you have to go through quite a developmental, iterative process to actually get to that product end. And that's actually a really good thing. So like everyone else has sort of talked about, getting out into the community, looking, asking, listening, ethnographic work, guided interviews, actually walk in someone else's shoes, live a day as they live it. And that's, once again, not just for the person that you're trying to shift outcomes for, that's also for frontline workers, policymakers. So we'll often spend days immersed in other not-for-profits or in a policy office or shadowing a worker, trying to understand how you actually build something that fits into the whole ecosystem, that's not just for building something that somebody wants. Then it's about going in, reframing, going out, testing out. So once again, it just shows that there's a certain amount of activity that happens in the office, but really where you'll learn the most and where you'll gain the most and where you'll shape the most is out there speaking to people. We live by this rule and it's done us well so far, and we're now starting to work with quite a few other government departments and not-for-profits to help shape their, I guess, internal policies and mechanisms so they can actually spend more time out of the office with people. And I remember, I'm a bit of a talker, and I used to get in trouble all the time when I was working in the child protection department for spending too much time with my clients, and I needed to spend more time behind my desk typing up my notes and writing my court reports. And so there's a real paradigm shift that needs to happen around the value of being with people, no matter where those people are or where they come from. So the example that I wanted to chat with you about today, because it's here in New South Wales, is Family by Family. And Family by Family was the first product or solution that came out of Taxi. And this draws quite heavily on some of the stuff that we've heard this morning from people like David around how we better utilise people and the capability and capacity that actually exists within our own citizens. And what this model aims to do is find families who have been through tough times, but they've come out the other side and they're doing well now. And we link them up with families that are still very much struggling, putting one foot in front of the other, often having a relationship with child protection services, domestic violence, mental health, a range of state sort of intervention in their life. And there was an interesting question this morning, I'm not quite sure where it came from, but someone mentioned that they were interested in this notion of more peer solutions just as a way of validating people, or if you even acknowledge them, that's enough to create some change. In our experience, that's not the case, and that family by family has gone through quite an intentional design prototyping phase to really understand how the sharing families, which are the mentor families, support and enable behaviour change. And Jane and I were having a chat coming up the stairs today about this notion of, you don't know what you don't know. And that's a classic case of lots of our seeking families, so the families that are needing support. They only know what their family looks like, or what generations of their family looks like. So how does family by family give them a new sense of possibility around what family could look like or could be like? And then how does someone actually support them to get there? And so family by family's been intentionally designed to create that behaviour change with families. And that's really what we're measuring. And we've been measuring the impact of family by family since day one. And I know that was discussed in the panel today. And I think it is important to ask yourself those critical questions from day one. And there are ways you can evaluate your program during a design prototyping phase by using developmental realist evaluation methods, and actually iterate and evolve as you go along. And all of our work has done that. And then as you get a more mature solution, policy, idea, then you can move more into developing a solid business case and cost-benefit analysis. So family by family's in its third or so year now. It's in South Australia and also New South Wales. It's still really early days, but it's gone through quite an authentic design process. And so if we look at this diagram here, it was actually designed in South Australia, and in terms of spending time out of the office, it was created with over 100 families in the south of Adelaide. So they were actively involved in the co-creation of ideas, the prototyping, the feedback, then the testing of those ideas over and over. And there's a little doco on our website about what it feels like to be a family that's involved in that process. And there was some significant outcomes just in being involved in that process. And now as we continue to develop and evolve the model, families still really sit front and centre with that. And how do we keep building and iterating and developing as communities change, as government changes, as life changes. So it's not a one-off process that just happens at the beginning. It's a belief and a philosophy that kind of really underpins our work. And I think that's really what's determined its success to date. So some of these families here are sharing families in Mount Druitt, and we've been up and running there since really October last year. And one of the most astounding things is when we moved out to Mount Druitt, we were given all sorts of warnings about what we would be in for in Mount Druitt. And I don't live in Sydney, but if any of you do, I'm sure you know what I'm talking about. And but what we actually stumbled across was just the most remarkable resource and the most remarkable inspiration in our sharing families. And we've had no problem whatsoever in finding this resource and using it to the best of its ability. And if you ever get to spend time with any of these families in this picture here, they're an absolute true inspiration. And they've managed to achieve far more with the families they've linked up with than what I ever did as a social worker. And that's not to devalue the role of social work. So the question we're asking now is, how can something like family by family that started off with quite an authentic design process and that was co-designed with 100 families in South Australia now start to influence the broader system and policy? And we had a great meeting with some of our New South Wales fax people a couple of weeks ago to just start exploring some of these bigger questions about what role can families like this play in the system, what role can they or should they be playing in society, and how can they ultimately add value, and hopefully that design and that what they've managed to achieve over the last few years will help take us to that place next. That's me.
Thank you, Carolyn. Thank you for reminding me particularly that it's about people. ultimately it's about people and family. So thank you. Hector, your time has come. I'm sorry about the mix-up. It's my fault. Hector Salazar Salame, Executive Director of the Abdul Latif Jameel Poverty Action Lab, JPAL, Southeast Asia. Please share your insights.
Is my mic good, everyone? All right, so there's a lot of pros and cons to going last. I would say that a big pro is that you get to hear what everyone has said, and it's really exciting to be able to not only talk a little bit about what you plan to talk about, but to respond and build off of a lot of what's been said. But then that's also a big con because my PowerPoint presentation does not necessarily follow what I would now like to say. And similarly, I'm the last thing standing before you get to ask your questions. So I will try to be brief, and I will maybe jump around my PowerPoint a little bit just to make the key points that I want to make, and also to respond to some of the things and build off of what we've already heard. So the title of my presentation is Designing Randomized Evaluations. So I was asked to talk a little bit about how you put together RCTs, and then ultimately how you can potentially have policy impact through the, well, RCTs, which is the experience of JPAL. This is the work that we do. But then generally when you're doing evaluations, you're trying to understand nudges and other types of interventions, how you actually achieve policy change from your findings. So the brief overview of the presentation, I'll tell you a little bit about JPAL, and then I want to talk about the main points that I want to discuss today through a case study of a recent RCT that we've just completed in Indonesia, and then some concluding thoughts. Just about JPAL very quick. We're a network of affiliated economists from around the world. Essentially what we believe is that social policy and poverty reduction strategies can be strengthened and made better if we have scientific evidence of what works, what doesn't, and why, and that then we can translate that research and those findings into action. And that's ultimately our objective. Over the past 10 years, we've conducted 524 evaluations. Probably that number is higher. This was from a week ago, in 57 countries around the world. And to tell you a little bit about Southeast Asia office, we just launched the office last year. We were privileged to have the president of Indonesia be our keynote speaker for our launch event last June. We have funding from the Australian Department for Foreign Affairs and Trade, so formerly AusAid, now DFAT. And we're based at the University of Indonesia at the Institute for Economic and Social Research. All of our offices, we have 6 offices around the world, we're all based at universities in the locations where we are. And we're led by professors from MIT and Harvard. We have 3 main activities across all of our offices. This is what all of our offices focus on. One, it's research, conducting rigorous impact evaluations. And I'll come back to this. This is going to be the crux of the presentation, what I'll be talking about. What do I mean by conducting rigorous impact evaluations? Second, policy outreach. As I was mentioning, it's the idea of translating findings into action. One of the key things about JPAL is we don't aim to do research just for the sake of research. We really want to have some form of policy impact. We want to be able to present these findings or have these findings be available so that we can act upon them or the policymakers can act upon them. And third is training. So our objective is that we're not the only show in town, that we're not the only type of organization in the countries where we work that can do this type of evaluation, that we build the capacity of other local organizations to be able to do this work over time. Now, I'm sure you all know quite a bit about RCTs, so I'll skip this slide, but essentially RCTs allow you to understand what the counterfactual is. What would have happened in the absence of your program compared to what happened with your program. And you're able to do that with internal validity using an RCT method. So that allows you to determine that the impact that you had, that you're measuring, is because of your program and nothing else. And this is, RCTs are what we focus on. That's our niche market, and that's what JPAL does. And before I move on to the next slide, I do want to mention one point. I think this is really important. I think oftentimes, and especially in this field over the last, maybe well, probably longer, but over the past 5 years, it seems to be a continuing contentious debate. You have the randomista camp, and then you have the non-randomista camp. If it's not an evaluation, if it's not randomized, then you have those that say, well, randomization doesn't really, sometimes it's not possible, or it's not the right approach, and there's so many other things that we can be doing. And I think the presentations that we've heard thus far really highlight that. I think that, and I want to point this out, that From a JPAL perspective, we do believe very much that RCTs are a wonderful way to do impact evaluation. And yes, they can be considered the gold standard in terms of being able to prove causality. But by no means does that mean that every project and every program needs to be evaluated using an RCT. And in fact, oftentimes a really well done process evaluation can be just as important or even better than an RCT, depending on the context and what it is that you're trying to understand. And I think some of the examples that we've heard today of other evaluation methods are really important. So I want to highlight that before we continue. Now, this is probably the most important slide that I'll show you today, and I want to spend a little bit of time talking about this. Evaluations don't just happen in a silo. I mean, they may sometimes. We might be sitting here in ourselves, in our minds, thinking, oh, I really want to evaluate this. It would be really interesting if I could do this or that, et cetera, et cetera. But the chances of you being able to just come up with this idea and say, I'm going to go do it, very slim, right? We all work in a very complex policy research environment where we have to collaborate with a lot of different people to get these types of evaluations off the ground, interventions and also the evaluation per se. I really love Jane's question at the beginning, who's a designer here? And I didn't know what to, I was like, well, maybe, I don't know, am I? And so I've been thinking about it a little bit, and I would say I'm a designer, I'm a liaison between researchers and policymakers, I'm a matchmaker, I'm a negotiator of a lot of different interests that a lot of different stakeholders have. And working within this first box is probably one of the most difficult things. And this is essentially where projects, I would say, really either happen or they don't. You can spend years working on putting together an evaluation, thinking through it, what are the right questions, what is it that you want to do, what you want to test. But you have to have this collaboration amongst all of these actors to actually make it happen. And as I'll argue, it's not just about making the program and the evaluation happen, but then afterwards, when you have the findings, if you've developed a strong coalition and a cooperation from a broad array of actors, that's when there's a vested interest by all of those to know what the findings are and act upon them. And so here I say in this box, and this is not representative of every actor, but research institutions, donors, community service organizations or NGOs, and government are critical actors within the sphere of bringing together the right actors to put together these programs, these ideas, and actualize them into impact evaluations. So I really want to keep this very clear, and I think it'll be a recurring theme over the next couple of minutes that I speak. And ultimately, it's through these collaborations that you implement the evaluation and you obtain the evaluation findings, and based on the evidence, you decide whether you're going to replicate, whether you're going to scale up, or what it is that you want to do with these findings. But ultimately, I also want to highlight this arrow, the blue arrow going back, and that's the ongoing and monitoring and evaluation. Just because you did the gold standard RCT, or you did a really interesting study that found some really interesting results, doesn't mean you're done. From my perspective, good research is research that leads you to even more research questions and makes you want to continue learning. And I was recently, a couple months back, at a conference, and someone said this so well that I've now stolen it, and I want to share that with you, in that in the hard sciences, it's great. It's so easy, right? Action, reaction, and you can hypothesize about it, you can test it, and you can see if it happens over and over again, right? In the social sciences, people are actors, and people adapt. Yeah? So even if something works now, it doesn't mean that it's going to work 6 months from now or a year from now. You do a project and you say, oh, by golly, I've figured it out. I've figured out how to reduce the leakages of this program in Indonesia, which we'll talk about. But in 2 years, perhaps the communities will find new ways to create leakages or work around the system that you've now implemented or established that worked a year ago. And so it's continually having to figure out what's happening on the ground, what's happening in the conditions that you affected maybe a year ago, and seeing how you need to continue to innovate. And so I think that that's a really important point to keep into account. So with that said, I want to talk very briefly about this project, Raskin. Who we worked with on this project was TNP2K, which is the national team for the acceleration of poverty reduction in the government of Indonesia. And it was funded by DFAT. Now, I want to highlight this because, as I mentioned earlier, the keynote address for our launch event last year was given by the president of Indonesia, and I think I just want to highlight that, not to boast, but simply to present that over the past 10 years, JPAL has developed very strong relationships with the Indonesian government. And I don't mean the Indonesian government generally, I mean specifically also within line agencies and with particular leaders within those agencies that have really supported this work and have grown with us as we've established more of the development of putting evidence-based policymaking more on the agenda for policymakers. And I think in this particular case, it is important to keep in mind as for this program, I want to highlight that then P2K, so the national team, which is under the vice president's office, reached out to us to say, listen, we're really interested to see whether we can do these Raskin identity cards to increase the subsidy that households receive for this subsidized rice program. Can you help us out? So that's an important point about building these relationships, and having worked with various government agencies over the past 10 years, our work is known, and as our results have impacted policy previously, line agencies know that they can come and request our support and ask us about how they could potentially do an impact evaluation for certain things. So let me go back very quick, and I think something that was brought up that was very important. At the beginning of any type of intervention or what it is that you think you might want to do, you need to understand and define what the problem is. Yeah? And oftentimes you find that really, well, is that really a problem or is it not really a problem? And you start doing your work on the ground, you start interviewing people, you start doing your qualitative work to determine what the conditions are on the ground, and you realize, well, that's not actually the problem at all, it's maybe this other issue. In this particular case, after a lot of that qualitative work that had been done both by some of our research associates, but a lot of other organizations that, we read a lot of literature, talked to a lot of people to figure out what the issues were with this particular program. So I want to highlight a few of these. So to give you a little bit of background, this is the largest social protection program in Indonesia. It's approximately 56% of all social spending goes to it. And essentially what it is, it's subsidized rice for poor households. So the government provides rice that households can purchase at 1,600 rupiah per kilogram, when in reality it should cost 7,000 rupiah per kilogram. So it's a large subsidy that the poorest households are meant to receive, and they're supposed to receive 15 kilograms per month. There's a lot of issues with the program. For example, beneficiaries pay 25% more than they should be paying. They purchase less than a third of what their entitled quota is. And so overall, they're only receiving about 30% of the subsidy as a whole, meaning there's 70% leakage in the program. That's the government is paying for a subsidy of $1.5 billion a year, and 70% of that is not going to the right people. So this is a big issue, yeah? So the government recognized this, and as I mentioned, then P2K came and said, we really want to think about this. But then we went to the ground and we looked at this literature and we looked at organizations that had done a lot of work related to this. Okay, what are the problems? What are the issues? Why is this happening? So there's three in particular. One, there's program transparency. People don't know how much they're entitled to, what the price should be. There's monopoly distribution. Once the rice gets to the village level, it's up to the village leader to distribute across the households. And there's an issue of conflict resolution. So this is cultural and also perhaps nefarious, and it's hard to separate the two. But if you're a village leader and you receive all of this rice, from a political point of view, but also from the Indonesian cultural point of view, you want to distribute it evenly to everyone in your village, right? You don't want just some people to get it and some people not to get it. So it doesn't matter if you're rich, middle class, or poor, you distribute it to everyone. But that's undermining the entire targeting system of the program, right? So it's an issue. So these are three key points that the research had highlighted before. And so ultimately, as I mentioned, then P2K was interested in looking at how we can strengthen this program. Now, I want to highlight this very important point, and that's point number 2 and 3. So they reached out to us in early 2012, so January 2012, and they said, we really want to do this program. Here's the catch. We need to make a decision for our budget as to whether we're going to use these identity cards. We're going to mail out identity cards to every poor household, and with these identity cards, people will know that they're a beneficiary, and so they'll get the subsidy that they're supposed to receive. And we need to prepare for the 2013 budget, so we need results by December. Great. Now, previously I'd worked for New York City government, so I knew that side of the table as well. And all of a sudden I found myself on the other side going, wait, we can't do that. And then just thinking to myself, 3 years ago, I was the one saying, no, we need it now. But this is a real issue, right? I mean, when you're developing these projects and you're working with policymakers, they're working perhaps on a very different timeline than you are. And so we said, well, let's see if we can make this work. And one of the things that you often hear about RCTs is, oh, they take too long. So if I said to you, you know, we had 18 months to do an RCT and give you the results, I think most everyone in this room would say, oh, well, at RCT, it's not feasible. Well, we did it, and here's how we did it. So first of all, we used a previous project sample to save time. So we had just completed a project about a year before that in 600 villages across Indonesia. So instead of having to do another baseline or to collect new information, we essentially used the end line from that past project as our baseline for this project. And so that was a way that we were able to shave off a lot of time and really get off the ground running. We randomized at the village level. I won't go into a lot of the specifics. We don't have the time for that. And it was within 6 districts across Indonesia. One of the key design questions that you're always going to have with any type of intervention is, where are you going to do it? And you're trying to find as much external representatives as you can. However, you have operational and budget limits, right? We would love to be able to work in NTT, NTB, or perhaps every single 70 of the 17,000 islands in Indonesia, but operationally, that's just not feasible. And so you have to be practical about where you're able to conduct your intervention. And in this particular case, these locations allow us to look at an urban-rural mix as well as the most highly populated areas of Indonesia. And so it allows us to at least say something that's representative from an external point of view, although, of course, never perfect, but it's better than not having tried to get a varied source of locations to work in. Treatment variations. So we had this Raskin ID card, as I mentioned. This is what the government wanted to do. They wanted to send it out to everyone, 15.5 million households, but first they wanted to test it. And we said, great. So you could say, well, all right, let's just do an RCT. You randomly get assigned to get a card, you don't get a card. And then at the end of the day, we can say, great, does the card work? Yes or no? I mean, we could, but is that really interesting? No, I mean, we really want to understand what the black box, right? What is it about the card that works? What aspects of the card can really function? And so what did we do? We varied by a number of different things. By design, some of the cards that we attempted had coupons on them, so families could rip off a coupon every month and turn it into the distributor. Some of them didn't have the coupons. Another variation, content. How did this work? I guess we have content, distribution, and socialization. So for content, we had price. So basically, as someone was mentioning earlier today, in terms of creating forms, it doesn't cost you but a drop of ink to put on what is the price that you should be paying for this. And we want to know, does it make a difference if it says on the card what the price of the subsidized rice is? We also had a distribution variation. We wanted to know, should we send the cards to every single one of the beneficiaries in the communities, or should we only send it to the poorest of the poor? Do we really need to print and send cards to every poor household, or just the poorest, and what will our outcomes look like afterwards? And lastly, we want to vary the socialization. Standard socialization, meaning that, I'll get into specifically what that means, but basically what level amount of socialization people were receiving about what this card is and how they were meant to use it, to see if that made an impact or difference. So ultimately, when we put all this together, you find that we have 17 groups. We have 17 variations that we're testing here. So to give you an example, group 1 is villages in group 1 are receiving, all the beneficiaries are receiving the card, plus they have the price on it, and they have a coupon. Meanwhile, group 11 is only given to the bottom 10, the poorest 10% in the village, have the price on it, but no coupon. So you can see here, as we start looking at these different variations, we can make some assessments, and we'll get to that. So like the variations that we've already talked about, so 368 receive cards, 194 serve as the control in terms of the villages, and as I've mentioned, there's a randomization into which set of variations each village receives. And in terms of the socialization, this was a key aspect, so I want to spend a minute on this. We really wanted to know what the difference is between what the government would typically do in terms of socialization, so that's just sending a letter along with the card and to the village leader, versus enhanced socialization, which is sending a facilitator out for 2 days to explain to the community what is the card, what is it meant to do, really understand what this is all about. And you can see that there's a picture of that happening here. So ultimately, based on this design and all of the different treatment groups that we were able to put together, you can compare, well, what happens with having the card versus not having the card. Yeah? But now we can also compare what happens if you have the standard socialization with the card versus enhanced socialization with the card. So you can divorce these, so you can figure out what the impact of each component of the things that we tested are. Similarly, what's the difference between the price, if you have the price printed on the card, versus not having the price printed on the card. And so you're able to test all of these variations, and you're able to open that black box and figure out, okay, did the card work? Yes, no? If yes, what aspects of the card, what led to the card functioning better or more effectively? So I'm running, I don't want to spend too much time, but I just wanted to highlight this to you, the timeline. As I said, this is very condensed timeline. We really used the baseline from the previous project, January, February 2012. We got into the ground in September of 2012, and by between November and December, we were already doing our midline. Why were we doing our midline 3 months later? Because the government wanted results. They wanted preliminary findings from us by December, which was a negotiation point for us. And we said, listen, we can do the midline, we can present you preliminary data on what's happening in the short run, but this has to be taken as potentially going to change, meaning that we're going to do an end line 6 months later, because we don't know if perhaps you send the cards out, they work, but then 3 months later, as I was mentioning, people adapt, and the village leaders find different ways to, continue the leakage problem. And so ultimately, our end line survey was done between March and May of 2013 to look at the more longer-term effects of the cards. And you can see there the presentations that we had for the government of Indonesia, which ultimately were meant to inform their policymaking. Lastly, the overall results that we found, with the regular socialization, you increase the amount of Raskin that a family purchases by 1.1 kilograms, and the increase in the subsidy that they receive is 6,659, so a 23% increase in the subsidy that eligible families are receiving with the regular socialization. With the enhanced socialization, that jumps up to 11,000 rupiah. Now, all of these numbers take into account that you print the price on the card, because we found that it costs nothing to do that, and it makes a difference to print the price. But ultimately, when we're looking at the forest from the trees, what this means is that the government was saving between 1.2 and 2.1 trillion rupiah extra a year from subsidies that are now going to the correct people. This is assuming that it was scaled up. Yeah, we did this as a pilot in 600 villages, but if this were to be a large-scale intervention, this is what you might project the estimates to be. We presented this to the government, and they essentially used these findings to inform their policy for distributing KPS, Kartu Pelindungan Sosial, which is basically a social protection card, which they have now distributed to 15.5 million households as of June of last year, and it gives low-income families that are eligible for these programs, such as Raskin, as well as scholarship for their kids, and a temporary a cash transfer program that was implemented given the fuel subsidy decrease in Indonesia. And so now 15.5 million households have this KPS cards, which identifies them as beneficiaries for these projects. And ultimately, this decision to have this policy and to distribute these cards to so many families was largely informed by the work that we had done over the course of 13 months. So I want to highlight that it's possible to do a rapid response RCT. There were many sleepless nights. We were doing this project right as we were starting the office. There was 2 of us working at the office at the time, so you can imagine it was pretty stressful. But we were able to do it, but we were only able to do it because we had the support of the government through TEN P2K, because we had the support of DFAT, because we had the right actors in the room from the beginning. And along those lines, some major conclusions. One is design the evaluations and the interventions that are rigorous, policy relevant, and practical. So I think we've talked about the rigor piece, we've talked about the policy relevance piece. This is something the government really cared about and wanted to know about, and so it was prime for doing an RCT and for doing a rigorous evaluation. Practical, I just want to highlight one thing on this that I haven't mentioned yet, is you don't want these things to be gold-plated, right? We could have said, well, let's send one facilitator to live with each household for a month. And well, that would have been great, right? I mean, you would have had wonderful results. Is that scalable? Absolutely not. So you want to make sure that when you're designing, you're taking into account what's actually potentially feasible to scale up. Multi-stakeholder collaboration is critical, and aim to understand what components of the program work by testing variations. So don't just look at it as a binomial, does this work, yes or no, but try to understand what aspects of something function. Thank you. And if you want to read more about any of this stuff, there's some suggested readings.
Thank you, Hector. Evidence is king. You've proven it. I'm mindful of the time and the fact that there's a 5:30 ferry leaving for Luna Park, but there is also a 6 o'clock ferry leaving for Luna Park. So rest assured you can get there, although some of the best questions have left the room for the 5:30, I've noticed. At this stage, a few questions I think are in order because this has been a fantastic afternoon. Who's able to, or who has a question to ask? Please. And if you could identify yourself and where you come from. Thanks.
Hello, my name is Richard Morris and I work for the Department of Department of Family and Community Services. The section that I work for is Ageing, Disability and Home Care. I work in Newcastle where the National Disability Insurance Scheme is currently being implemented in trial. My question, however, relates to leadership and the role of leadership in good design. And I notice our first presenter made reference to it explicitly. I believe that it's also an issue for others.
Jane, please.
My view very quickly sort of echoes that of some of the sort of critical leaders of corporations in Australia and around the world, that it's fundamental to leadership to actually get an understanding of design thinking and to question and challenge the way in which they've done things in the past and how things might be different into the future. And that is what real leadership is as compared to creating a sort of a buffer between what's happened before and what might be into the future. So it's evident in many companies in Australia now. They're actually employing design thinking guides. Roger Martin's advising Westpac. Telstra's got some design thinking going on. Deloitte's has taken their top 500 around the world to understand about design thinking. It's not impossible to think that the rest of the organisations in Australia can equally do it. I think New South Wales executives are also being exposed to these things. The key is not just to hear it, but to start doing it. And I think that's where the sort of the big jump goes. But then again, to actually apply it in small doses so that learning can happen as you go.
And I think all I would add to that as well is what was brought up earlier today. I think leadership from a particular individual is great to get the process started, but ultimately what you want to do is build an adaptive system and to build the capability into the system, which means having policy, space, systems, processes that enable that to happen. Because and we've been in the case where, you know, we've had particular champions flying the flag for us, but people leave, right? So how do you actually build it into the DNA of your department and of your organisation? And there is some of that work starting to happen now, but it does involve us thinking a lot more creatively about the sorts of capabilities that we employ into our departments and our institutions. So yeah, I would just reiterate that building the systems and the space and the processes is equally as important as a particular leader per se.
I think, can I just add to that? If you can build into the organisation the capacity to listen to customers and outsiders and people within, that actually sticks around for a really long time, because after a while it becomes quite addictive to actually find out what you don't know and to actually get some guidance about what can work.